Okay, everyone, so after that introduction, I am live and ready for questions. So, happy to answer anything and everything if I can. Feel free to ask away. Your questions will come up on my phone, and I should be able to answer it as they're coming through. All right, so we have a question here from Uniboob Lady. All right, look, the question is that the patient has had a breast reduction, Hi Beck, how are you? The question from Uniboob Lady is that she's had a breast reduction and the outcome is now a uniboob, and I can see the photograph that you've sent through to me as well. From what I can see, you said you'd had nice natural cleavage previously, but there's now no cleavage at all. Is liposuction done to obtain a nice cleavage? You've had to cram your breast into a push-up bra to obtain any cleavage definition at all. Now, this is an interesting question, and this is an interesting image that you've sent up. When you do a breast reduction procedure, and it looks like you've had a reasonable reduction there, one of the things that you try and avoid is a symastia, and a symastia is actually bringing the two edges of the breast together as part of your reduction design. And from what I can see in the image that you've provided, it looks like your breasts are actually, your incisions might have been a little bit too close together. So from what I can see from the image that you've provided, I'm not sure whether a liposuction procedure is the ideal scenario for you. It may very well be that you need to revise the medial aspect of your breast reduction to actually reduce the actual line in between, in your midline, to try and actually give you a little bit of cleavage space, because it actually looks like the two scars are meeting each other. So without actually physically seeing your scar, it will be difficult to tell you, but from what I can see, if you've had purely a breast reduction procedure, then this is a complication or problem that you can encounter as a result of the design of the reduction. And you do try and avoid this as you're doing it. If you have, it's an interesting question, because if you actually have a breast augmentation, then one of the things that we try very hard to avoid is actually having symastia by dissecting the pockets on both sides and bringing them too close to each other, and then you can end up having a uniboob as a result of that. So have a look at that, have a look at your incisions where your scars have been made, and then maybe it's worth having a chat to your surgeon. But I don't think liposuction is necessarily the way to go here. There may need to be a bit more revision. All right, so next question. I've got an anonymous question. Patient's lost 18 kilograms since November of last year. Nowhere near your goal weight yet, but congratulations on losing 18 kilos to begin with. And you have a heavy, uncomfortable apron of skin that sits on both your upper legs and let me just read that again, and an enlarged mons. It's been causing ongoing issues since losing the initial 14 kilograms. Along with the majority of my fat distribution is subcutaneous. Okay. Unlikely to lose any more weight. Can a tummy tuck be done and have the fat removed, or is it just the skin that's removed? All right, now that's actually a very interesting question. When you look at tummy tucks, one of the actual aims of doing a tummy tuck is to do it on a patient who has reached their goal weight, or actually is close to their goal weight. And in my practice, it's actually getting to a weight that you're going to stay stable. It'll happily stay stable. Sometimes it's really, really crazy to get into a crash diet, get yourself down, and then try and stay there. And the hardest part, in my opinion, is trying to stay there. So if you are actually losing weight and continuing to lose weight and you've got an excess skin, step one is, it's difficult to say, but if you're still losing weight, continue to do that until you get yourself to a stable weight, a weight that you're happy with, and a weight that you can maintain. Once you are there, that's when you want to go ahead and have surgery. If you have surgery prior to that, you've got to remember the surgeon's operating at for you on a snapshot, and that's what you present as to the surgeon on the day. And if you're down to that weight and not quite exactly where you want to be, or if after surgery you continue to lose weight, you're going to end up not getting the best result from your surgery. You're going to end up having a scenario where the surgeon's got the best result he can on the day for you, but if you lose more weight, there'll be excess skin again. So my advice would be to maintain as much as you can, get down to where you can, maintain that. Ideally, most surgeons would like about 3 to 6 months of stability, and then go and have your surgery at that stage. So yes, it is difficult. You will have extra skin. You may have an apron. You may have things hanging down. But if you are still losing weight and not plateauing, then it's an ideal situation to wait and then have your surgery then. Hope that one helps. Now, next question is, you've had a massive amount of skin removed with an arm lift and breast reduction. There is some skin under the armpit near the shoulder area. Would additional lipo help this area? Yeah, look, that's an interesting question again, because it depends on how much weight you've lost, and it also depends on how the design of the breast reduction is. I would need to see, or your surgeon would need to actually see where that excess skin is and see what can be done about it. Liposuction is an option if the extra skin is, it's a combination of skin and fat, and it's a question that your surgeon would have to answer for you in terms of will the skin take in when you're having the liposuction to remove that area. The alternate may be that you need an extension of your incision, so the cut needs to be made longer and you need to cut some of that area out. It does mean a slightly longer scar, but it may mean removal of that tissue that you're not happy with. And again, one of the other things to think about, now this is not going to work for everybody, but in the occasional patient, it's an area sort of up here, people call it sort of the bra puff area. You might even be able to cool sculpt that or freeze the fat. That's something that we've seen improvement in with some of our patients. You may be able to remove it through that. So look for someone in your area that provides that, and most consultations should be complimentary, and they may be able to help you with that. But if you have lost weight, if you've had a reduction and you've had arm surgery and there is tissue still around, you can remove it as part of a dog ear excision. You may be able to liposuck it, or you may need to extend the incision. It's very difficult to comment on that without actually seeing exactly where it is and how it is in relation to your scars, but I would suggest that that's the best way to approach that. Now, I've got a question from Sandy. How long after having a tummy tuck surgery can I travel on a overseas holiday? As soon as you're feeling well, I guess, but most people will tell you that when you've had a tummy tuck surgery, it takes a few weeks to start feeling 100% better. In that situation, you will find that it takes around 6 weeks before most surgeons are happy for you to go about doing most normal things. And by most normal things, I mean getting up and lifting something more than 5 kilograms, for example. Your wound will have healed very well in between 14 to 21 days. What will be the issue then is, if you're going on a holiday, how much can you lift in terms of your suitcases or whatever else you're going to take with you. And the other thing that you're going to need to think about is when you are on the holiday, you want to be able to hit the beach, you want to be able to go around and relax in the pool, etc. A long flight, depending on where you're going, you'll be sitting around for a while on a plane flight. That may be uncomfortable. So I think most of the surgeons I work with, and certainly from my point of view, would say that you need a 4 to 6 week recovery period after a abdominoplasty, after a tummy tuck. And once you've had that, in essence, get back to doing everything that's normal. So, have your tummy tuck and get into that cozy that you want to, and get there in about 6 weeks' time. Okay, where's the next question? Here we go. Vanessa's asked a question. 2 weeks post a breast reduction and lift combination, and you're very itchy. You have tape scars for 3 months. What can I use to stop the itch? Now, this is something that's actually very common, and I guess there's a good and a bad part to this. The bad part is that it's itchy. The good part is it means you're healing. So, you're putting tape on, you may actually have an allergy to the tape. So that's something you need to think about. If it's itchy and you get a bit of a red line around where the tape is, you may have to change the tape or the adhesive that you're using for the tape. That's something you may want to think about. Otherwise, the things that I've found very useful in patients, there we go. The things that I find useful in patients such as yourself are moisturizing creams and an antihistamine. Now, Claritine or something similar can help the itching quite a lot. Try and pick one that's non-sedating. You don't want to have sedated for the entire day while you've got this itch, but using a non-sedating antihistamine and using a moisturizing cream usually is enough to deal with the scars. The good thing about using a moisturizing cream, of course, is that you're going to be massaging and moisturizing your scar, and that can also only help make the scar better. Eva's asked a question. Eva's asked a question. You're type 1 diabetic and you're wanting to get a rhinoplasty. What kind of complications, so you use insulin, what kind of complications would this cause, or would it be safe to go ahead? I'm assuming you have to get it done. All right, Eva. Look, Eva, you're not the first diabetic any plastic surgeon has worked on, and you certainly will not be the last. There's a few important things that we need to take into consideration, and if they're fine, then there is absolutely no reason why you can't have this surgery. The most important thing is how stable and well controlled your diabetes is. If you are somebody who is an insulin-dependent diabetic and you are well controlled and you are happy and your endocrinologist or your GP is happy with your sugar control, then realistically your complication rate for a rhinoplasty should be essentially the same as somebody who's not a diabetic. Now, when you do have diabetes, yes, there are some things that can be worsened. Wound healing is the main thing, and allowing wounds to heal properly in a diabetic is a little bit slower and delayed. But to a large degree, that is based on how poorly controlled or how well controlled your diabetes is. So if your diabetes is well controlled, and everyone around you is happy and your doctors that look after you are happy, go ahead and have the surgery. It should not cause any difference in your complication rate. Narelle has asked, is there any benefit to wearing compression garments longer than the recommended 6 weeks? It's a personal choice. I have some patients, and I know a lot of surgeons have some patients who enjoy the comfort and the stability that some of their pressure garments give them, and as a result they do wear them longer. And certainly if you're wearing a tummy one, it can actually help support. And if you have a breast garment, some patients will wear it at night for longer, particularly if you've had a breast lift. The longer you have them on, obviously the better it is from an anti-gravity point of view. So I certainly recommend patients of mine who have had a breast lift to wear some sort of support for as long as possible. A non-underwire bra, a sports bra, every night from the operation onwards. So wearing your compression garment can help. Now, different people heal at slightly different rates. So if you've still got some edema, if you've still got some discomfort, which is then stabilized by wearing your pressure garment, by all means wear it. Most people I know, though, look, let's face it, they're not the height of fashion, and you can actually get, they're not very pretty. And by the time 6 weeks comes along, the vast majority of patients want them out and start wearing their sexy bras or start wearing something nicer for their abdomens, Spanx or even bike shorts in some patients' cases. So it's a personal choice. If you are feeling benefit and if you think it's working for you in terms of edema control, by all means wear it longer. From a breast point of view, by all means keep it on. It just helps from an anti-gravity point of view, but there are alternates Does it help make the wound any better than if you didn't do it from 6 weeks onwards? I don't think it makes that much of a difference. It becomes more a personal comfort issue. Next question is from Zoe. Zoe's asked, is there a high recurrence of breast increasing in size post-breast reductions in pregnancy? And, okay, so this is a physiological question, Zoe, and the reason she said she's asking is she's planning to have another child, but she's, there's a lot of strain on the back and you may want to consider having a breast reduction. Nothing a surgeon can do is going to be able to stop Mother Nature. So having a breast reduction removes breast tissue, right? But when you have kids, you're going to increase your breast size, irrespective of whether you've had a breast reduction or not. So it's a tough question to work out exactly how much you're going to increase. You're going to increase a volume. What that volume is anybody's guess. Would it be something that you could, I guess, think about postponing? Because the ideal scenario is that if you have a breast reduction surgery, then go on to have a child or children after that, yes, your breast will increase in size or change shape. It may then negate, or it may then sort of put to waste some of the operating benefits that you received. Now, if you can then, in that situation, have your children, plan to have your family, and then subsequently go for one breast reduction, that is the ideal scenario. But if it is that life, constraining for you, provided you utilize the same pedicle, or your surgeon knows that they've used, medial pedicle or superior pedicle, and you use it again, it shouldn't threaten your nipples, and you can do another breast reduction after having had one breast reduction. The other question that often comes along with that is, can you breastfeed after a breast reduction? The answer is that a third of women can breastfeed in life, a third of women need assistance with breastfeeding, and a third of women can't. Breast reduction surgery doesn't change that, or shouldn't change that. So if you are someone that needed assistance and may have needed assistance before, well, that'll be the same scenario afterwards. So that shouldn't be something to stop you from having the surgery if it is that uncomfortable for you. It's a little bit of a discussion with your surgeon, a little bit of discussion with your husband and yourself, and working out the right timeline and the right planning in terms of when you're going to have your future children. So good luck with that. Sammy's got a question. Is it safe to have a tattoo removal post-implants? Part of the tattoo was cut off during the initial breast augment. It's an interesting location for that tattoo. And with the revision, more will be cut off. You'd like to know whether, is it safe to have the procedure if you've had implants, and when's the best time? Look, it's absolutely safe. Tattooing is a very superficial procedure. It's using the skin and the upper part of the skin. I am presuming that if you're having implants and the location of the tattoo will be an issue, is the location where your current incision will be for your breast implantation. That's the only thing you need to worry about and think about. So if your breast implant incision is in your breast crease, and that's where your breast that's where tattoo is, wait till everything heals, and that can be anywhere from 2 to 4 weeks. Ideally, I'd wait a little bit longer than that, just to make sure everything's stabilized. And then if you want to have that tattoo removed, by all means do it. It's not going to affect your breast implants. They should be much deeper and well away from anything from the skin. If, on the other hand, your tattoo is actually physically on your breast, completely unrelated to any cuts your surgeon has made, you can pick and choose your time. You can do it straight afterwards. You can do it before surgery, and it really doesn't make that much of a difference. Naomi has a question. Naomi's thinking about looking at breast reduction and a breast lift. Okay, is the area under arm and back fat reduced when this surgery is done? Naomi, it really boils down to how large your breasts are. If you have really large pendulous breasts, then certainly the sort of side part underneath your arm, sort of in the armpit, the breast hanging into that area, will be reduced. And depending on how much you actually reduce, you may pull in some of the back fat as well. It may just be part of your incision markings. But If you have a smaller size breast and the reduction happens, then you may not necessarily have the back area touched at all, and a limited area underneath your arm. So it will boil down to how big your breasts are, and it'll boil down to what sort of design pattern your surgeon chooses for you, whether it's a sort of an anchor a pattern or whether it's more of a lollipop pattern, and that'll give a better idea of how much tissue is being removed. Mel's got a question. What is the best cream or ointment to reduce the looks of scars? Mel, if I knew that, I wouldn't be talking to you right now. I would be in the Bahamas sipping on a pina colada, I can tell you now. There are a million different things that people will tell you, and I don't have a hard and fast answer to what is the best cream or ointment. What I can tell you is the literature on this is limited. There has been evidence to show that vitamin E is good for scars and good for healing. There is not a lot of evidence to show anything else in terms of medications is any better than anything else that's out there. Every company in cream will tell you that their cream is better than the other. We know that silicone works, and so I recommend silicone-based creams. I think silicone-based creams do have a benefit. But most importantly, I think vitamin E, in some way, shape, or form, in combination with something, is where you need to be. So that could be Vaseline with vitamin E. It could be Sorbolene with vitamin E. Some people use, it's something like that you would want to use to help reduce the look of the scars. There is a very strong school of thought, and something that I very strongly believe in, that it's not necessarily the cream that you're using, but it's the actual action of the massage. It's actually rubbing in that area and breaking down the scars. It's actually softening that. That is equally, or if not more important than what you're actually doing it with. So when my patients ask me that question, my immediate answer is, look, do you have something in preference? Do you use a particular moisturizing cream? Do you have something at home that you would like to use? Don't fall for the praise of, snake oil salesmen, bio oils, all this sort of stuff. Yeah, they're good, they work, but they don't work, sort of that much better than anything else that's out there. So apply pressure, because pressure has been shown to improve scars, so you might want to tape your scars down. Use something that's a moisturizer, whatever your personal preference is, but use it regularly, 3 or 4 times a day. Massage for 1 or 2 minutes each time, and massage it quite strongly. If you have something with vitamin E, use that. That may be a little bit better. But is there any one thing that is above and better anything else? I don't think there is, or certainly I don't buy into that. Morticia Matthews. Can you get liposuction in an area more than once, or would true sculpting be a better idea? Morticia, you can get liposuction in one area more than once. I guess it depends on your personal preference. It depends on your experience, and it depends on what your experience was with that liposuction and how much more is left to remove. If you have a large amount of fat still left to remove, and it has to be fat, it can't be excess skin post your liposuction, then you could target that with liposuction. You could target that with true sculpting or vaso liposuction, and certainly with cool sculpting. If the area is limited, if the area is small, and it's just a little pocket that's left over, you may want to consider a more limited non-surgical approach. Cool sculpting is excellent. Look, I have it in my practice, and I'm seeing excellent results with it. But it's not for everybody, and you have to be the right person, the right candidate. The combination of cool sculpting, cool sculpting works much better when you've got a lot of fat underneath your skin. Once you've had liposuction, you may form scar tissue, and you may have more fibrous tissue rather than pure fatty tissue. In that situation, you might not get as good a result with cool sculpting, despite having had excess tissue there. So the difficulty is, one, you need to look at the area, you need to look at how much you need to remove, and then you need to decide what's going to be best bang for buck for you. If it's a small area, at the end of the day, a non-surgical option, which there's a few of, cool sculpting is one of the options. On average, they're about half the price of liposuction. You don't have a general anesthetic. You don't have to wear a garment for 6 weeks, and there's a lot of pros on it. So if it's a small area, if it's an area that is you think you can get a little bit more contouring done, then a sculpting procedure is better. If it's a larger area still to treat, then look, I think in some patients you probably head back down the liposuction pathway. A lot of it will be personal choice, though, in terms of how your experience was with your first liposuction procedure. Melissa, I'm not even going to try and pronounce your middle name there. Is it possible to do arms, thighs, tummy tuck, and a breast augmentation in one surgery? Yes, it is. Absolutely. The question is, what's the stamina of your surgeon and what's the stamina of yourself? Because that's quite a lot of surgery to do in one hit. It is not uncommon to do a tummy tuck and a breast procedure in one sitting. So that could be a tummy tuck as well as a breast lift or a breast augmentation or a breast reduction. And it's very commonly, most people would call that a mummy makeover or a term such as that. I don't tend to use the word makeover because that sort of tends to imply that there's something bad that's happened post-pregnancy and you need to be made over. It's more rejuvenation is how I see it. But yes, absolutely, you can do a tummy tuck and you can do a breast procedure at the same time. Now, when it comes to the arms and the thighs, if it is something limited, I don't mind. So it might be a bit of liposuction in the arms and the thighs. And then, yes, sure, I'd do it in one sitting. It boils down to exactly what you're going to need to have done and what your tolerance is going to be. It's a lot of surgery. It can all be done in one hit, but the recovery can be quite difficult. And if you think about it, you're going to be limited in what you can do from a tummy tuck. And then if your arms limit you from doing things further, then you're kind of sitting there, sort of something about Mary with your arms out and not doing anything with like a cast on your entire body, not really being able to do very much. Now you might have a very helpful partner who can sort of help you in that situation, but you might not. So I think you have to be realistic. I think you have to think about what you can do not only during the surgery, you can do a lot during the surgery, but what can you do afterwards and what is your recovery going to be like and what can you do for 6 weeks, or will you have people support you? Your support network will be important, as will be your physical tolerance to the discomfort and the pain, and there will be some when the more you operate after that procedure. So think about that. Narelle's asking, arms and thigh scars have gone a bit firm or rope-like. What's the best way to soften scars? Well, Narelle, I'll probably refer you to my earlier reply. I think with the scars being thicker, I think massaging and moisturizing are the two most important things you can do for a scar at any particular time. Sometimes lasers can help soften the scar, and there are some lasers that are designed to help improve the color and thickness of a scar. Even some things like microneedling, and I guess someone would need to see your scars and work out exactly how wide and how thick they are. But things like microneedling, using a micro pen, for example, can help soften the scars as well. So massaging and moisturizing and pressure are the three absolute crucial things for any scars. And the more you moisturize and massage, combine the two, the more that you can do both of those, the better your scar is going to be. Remember that while the scar is immature, that can be, while the scar has still got this sort of a reddish color, it's an immature scar. So until the scar actually starts to match the rest of your skin, it's not a completely mature scar. And until it gets to that point, you do have time to try and make that scar better. Kim. Hi, Kim. Your question is, what's your thoughts on the risk of infections with thigh lifts? How high is the risk? Yeah, look, the risk of any surgery is infection and bleeding. Some surgery, it really boils down to where you're being operated on. So bowel surgery or surgery on the bum, for example, might have a slightly higher risk. Now, with a thigh lift, there is a risk of infection because it is around the genitalia that your incision is made, but that shouldn't be anything significantly higher or different to any other area. So provided it's looked after, provided it's well sealed until it's healed, you've got the right dressings, it shouldn't really change very much the overall risk of that procedure. So I wouldn't be going into a thigh lift thinking that your risk is significantly higher for for infection. As long as it's looked after well and treated and operated on appropriately, then I don't think you have to worry too much about that. Beck. Oh, Beck was the first person that was on earlier today. Beck, what kind of considerations do you take into account with relation for someone with factor V Leiden mutation and a history of PEs? Good question, Beck. This is something that I actually had to think about because I just had a patient with factor V Leiden. And on her, we did a complete mummy makeover. So she had a tummy tuck and she had a breast reduction as well. A lot of things to take into account here because, as you know, with factor V Leiden, you increase your risk of clotting, and it sounds like you've got a history of PEs. The first thing that I did, the first most important thing that you need to do and your surgeon needs to do is have a chat to whoever is looking after you from a hematology point of view. You speak to your hematologist and you work out your risk factor and your risk rates and how high that is in your particular case. Some people have the mutation and have never had a PE or anything like that. Someone who's got a history of PEs, look, your risk and your complication rate is significantly higher. If that happens, you have to decide, there's a long discussion process of whether the operation is in your best interest or not. When it comes to the operation, if you are eligible and if you've had those conversations and your hematologist is happy that your risk profile is, reasonable, then what we tend to do is anticoagulate the patient earlier. You get the patient up, you get the patient moving as quickly as you can, and heparin or a similar anticoagulant is started much earlier than you would, maybe the night before rather than the day after. You do have to warn your patient, and you do have to take into account that by doing that and thinning the blood a little bit earlier while you're still forming your clots, does increase significantly your chance of, well, not significantly, but it does increase your risk of bleeding straight after surgery. So your surgeon has to be meticulous in getting good hemostasis, and then you have to be aware that you may need to go back to theatre in case there's a bleed and stop. It's something that you will need to take into account. So it's a multidisciplinary approach if you've got factor V Leiden, and you need to make sure that everybody is happy and the risks and benefits are really explained to you before you go ahead and have that surgery, because there are potential life-threatening complications, and no elective surgery is worth that at the end of the day. Amy. Hi. G'day, Amy. How are you? Okay, Trish, there's an anonymous question. Patient is nearly 20 and one breast is bigger than the other. You've had that since puberty and it's really gotten more noticeable in the last 2 years, so it makes this patient uncomfortable. Can't wear certain clothes. Look, I totally understand that and feel people will stare. You can get an implant for breast. The question is, can you get breast implants? The answer is yes. You can get a breast implant augmentation on one side. It is very common to get asymmetrical breast augmentation either on one side or both sides, and sort of adjust that and have asymmetrical implants to adjust that. And you also can think of other options. If one breast is quite large, you might want to think about a breast reduction or a breast lift procedure on that side, along with an implant and a larger implant on the other side. There are lots of options, and certainly if you're only going to have one and there is a reasonable difference in size, there is an item number for that, which means that you would quite possibly be able to get a reasonable rebate for that as well. Whole body lift, Kylie. Kylie, a whole body lift is possible. The question is, do you want a whole body lift, and what do you mean by a whole body lift? Patients with massive weight loss do have body lift, which is tummy, back, legs, and then everything else on the upper half of the body. But it's a question that you need to sort of think about long and hard. It's a question your plastic surgeon needs to talk to you about. And often, where you may think that you need to have something done, if you have some smaller surgery done, you might not need the whole thing done. You might need just a small amount done to get the results that you want. It's a question, can you do most of the body in terms of lifting? Yes, you can, but is it something that you need to do? It's going to boil down to you and your plastic surgeon. I think we've got time for a couple more questions. We're sort of gone over time, but I'll stay back and answer a couple more questions while we've done that. Amy's had 4 lap bands and now a sleeve. What might my tummy look like inside? With all these previous surgeries, make it difficult for a surgeon to perform a tummy tuck. Amy, if your tummy tucks have been done through laparoscopic surgery, whether 1, 2, 3, or 4, it shouldn't make a difference. If you've had big open cuts, then it does make a difference from the viability of your tummy point of view. If they're keyhole surgery, laparoscopic procedures, then no, I don't think it should make any difference whether you can have a tummy tuck or not. What does your tummy look like inside? I absolutely have no idea. You've had lap bands in a sleeve. You could have a really small tummy. You could have one that's stretched out. I haven't done general surgery for about 20 years now, so I would hesitate to guess. But whatever it looks like, hopefully you and I don't get to see it, and hopefully your tummy tuck hides all of it afterwards. Steph has got a question. After having a breast lift and reduction, can you get a breast augmentation without an issue with the breast pocket? Steph, having a breast lift and reduction, can you get a breast augment without an issue with the breast pocket? Yes, you can, absolutely. We might make this the last question for the night. So I'll just explain that a breast lift and reduction works on one certain plane. Putting the implant doesn't necessarily have to go into that same plane. You can go beneath the muscle. And if you went underneath the muscle and did the breast lift above it, it's absolutely fine. Or you can go above the muscle and do the breast lift and reduction, which is something that I do quite regularly, and it really doesn't have a bearing. Provided your surgeon's competent, has done that before, and provided your surgeon is happy to do that for you, I don't think there would be an issue with the breast pocket. Right, guys, look, this has been a very popular session. It's 10 minutes after what we thought we would. I will have to leave it there, unfortunately, for today. But this has been excellent. I've really enjoyed it, and I hope I've been able to answer some of your questions for you. Please feel free to keep asking us questions or forward it on the forum. And if you would like to have another one of these coming up shortly, I'd be more than happy to do that again. Right, everyone, have a good night. I'm about to go home and put my little ones to bed. All right, good night, everyone.